Do you sometimes feel like people are watching you, even when no one is around? Or have you ever believed something that others say isn't true, like thinking the TV is sending you secret messages? These might sound like just strange thoughts, but if they show up suddenly and strongly for less than a month, it could be a sign of brief psychotic disorder. It's like your mind gets a temporary glitch. You lose touch with reality for a short time. But the good news, it usually goes away quickly. Imagine you're watching a clear movie, but suddenly the screen gets fuzzy with strange scenes no one else sees. That's similar to what someone with this disorder experiences, but only for a few days or weeks. What causes this mind glitch? Well, think of your brain like a phone. If you overload it with stress, it might freeze or crash. Big life events, like losing a loved one, a breakup, or even good stress like moving to a new country, can overload the brain. Some people are also more sensitive due to family history. For example, if your mom or uncle had mental health challenges, you might be more at risk. It's not your fault, just like someone with asthma can't control their breathing in smoke. Someone prone to this disorder can struggle when life gets too intense. Also, drugs like marijuana or hallucinogens can trigger it in rare cases, especially in young adults. Let's play a quick game. Raise your hand if you've ever heard a voice calling your name when no one was there. Once, okay. But what if it happened daily, and the voice said scary things? That's a hallucination, one symptom. Or imagine being 100% sure your roommate is spying on you through the Wi-Fi camera, even with no proof. That's a delusion. Other signs include confusing speech, like jumping from topic to topic with no link, or acting super strange, wearing winter coats in summer or talking to the ceiling. These symptoms last at least one day, but no more than 1 month. And after that, most people return to normal, like waking up from a weird dream. How do doctors know it's brief psychotic disorder and not something else? They talk to you, ask about your thoughts, and check if drugs, brain injury, or conditions like schizophrenia or bipolar disorder are behind it. If symptoms go away in less than a month and don't come back often, it fits this diagnosis. Treatments include short-term antipsychotic medicine, like a pause button for the mind, to calm the symptoms. Therapy also helps, especially talking with a counselor to understand what triggered it. For example, after a tough breakup, therapy can help you process emotion so your brain doesn't overheat again. Most people recover fully with fast care. Can we stop it before it starts? Not always, but we can lower the risk. Think of mental health like fitness. If you exercise daily, eat well and sleep enough, your body stays strong. Same for your mind. Managing stress with meditation, journaling, or talking to a friend helps. If you know big changes are coming, a job loss or exam week, plan extra self-care. It's like bringing an umbrella before the storm. For people with past episodes, doctors may suggest ongoing therapy as a safety net. Spotting early signs, like trouble sleeping or feeling paranoid, and acting fast makes a big difference. Scientists are learning more every day. Recent studies show that the brain's filter for information might get disrupted in this disorder, so too many signals get through, causing confusion. New apps are being tested that help patients report symptoms daily using their phones, so doctors can step in early. Also, researchers are testing low-dose medicines and therapy right after a stressful event to prevent episodes. One 2023 study found that mindfulness training reduced relapse in young adults. The goal is to predict and protect, like a weather forecast for the mind, so no one has to go through the storm alone.